Yo, what's up, YouTube? Instead of showing my hideous face for this video, we are going to go on a walk in the park, and I wanted the environment for this to be smooth because I wanted to talk about the truth about being a nurse. I'm not going to say what particular kind of nurse I am, but I would go in detail on a particular field, if you will. So, like as far as being med surge. If you're a student trying to pursue it, or if you're in it and you agree or disagree, or if you're a patient, or if you know someone, if you have a family member that's a patient in it, um, like, comment, and subscribe. Also share. Tell me if you agree. Tell me if you disagree. But maybe if you're not in it, it give you perspective, man. Although I don't want to go into the particular level of nursing that I practice, um, just to give you a little intel on what I mean about that, you have different levels. Like, of course, you got the CNA, you got the LVN, you got the RN. Um, but in the hospital, it's a collective effort. That's why I don't like going into particulars on it, because it is a collective effort. So with that said, I want to talk to you guys about the truth about being a nurse. I'm not one that has like 10-year experience, or even 5 years experience, but I feel that I do got the experience to talk about it right now, and I had a particular shift that inspired me to do the video. Um, so working in the hospital, right? The particular field is med surg, right? So you gotta you gotta figure what kind of patients are we getting. Like, they're not and let me say this part, in med surg you got two different kinds, right? You have long-term acute care, which they call LTAC sometimes, and you also have what else? You have like short-term, just acute care, in which they have surgery, and they get out um, within a day or two, or within 3 days, depending on insurance. This is a cool part, y'all. This, I ain't gonna say what it said because I don't want to like stalking me, but this is what it said. But anyway, back on topic. So, um, I have experience in med surg now, almost 2 years, and whatever nursing I do, right? So, med surg, you don't have severe patients to where there'll be like ICU, because then it'll be a ratio of one nurse to two patients, if I'm not mistaken. And ICU nurses tell me if I'm right on this. Um, and although it's not severe patients like that, we do occasionally have some ICU patients that if the ICU can't house it, they'll come to us. It's not, med-surg is also not emergency, so it's not like they'll like come to us first all the time. If it's something like a gunshot that happened freshly, they'll go to the emergency room, and then they'll go to the operating room, and then from there they'll probably go to like med surg after they get their wound, like surgically taken care of. And so even though it's not severe, med surg is not like, easy neither. Like, meaning it's not severe patients, but it's not like patients that are fully stable. Med-surg is kind of in the middle. It's in the middle of being in the middle to severe, if that makes sense. So on a 0 to 10 scale of emergency room, and if ICU is like 100, I would say med-surg is at a 75, if you will. 75. It could go as high as like an 85, sometimes even in the 100. Sometimes it go as low as like 20. But I'll give med surge on severity level, I would give it around the 75. That's the average day. Now, the problem with that is that we don't have the little ratios like one nurse per two patients. We typically have like 4 to 5 patients, and depending on where you work, If you're like a registered nurse, you're covering for IV medication, fluids and maintenance for like the LVN. So you could find yourself having like 7 patients, kind of, and if you don't take them serious as patients, and if an emergency happens, if you don't take them serious as patients, and if an emergency happens, uh, that's your license on the line. That's your ASS on the line, if you know what I mean. When those patients die, you would get in trouble for it. And you want to take care of your patients. Even without me saying that, you want to make sure your patients are safe and all of that. So yeah, so that's just to paint a picture overall of how med surg is, right? Um, so where I particularly work, I have like 4 to 5 patients, and occasionally we'll cover if it's a discharge or IV maintenance medication or IV antibiotics. I'll typically have like 2 more patients, so probably like 7 patients. So it's a really busy day. One of the challenges is that a lot of the patients and the family members of I would say more so the patients' family members, they don't understand the internals of things, right? Like you want to always talk to the nurse. You want the nurse to spend a lot of time in your particular loved one's room, and I totally get that. Um, and I say that that's a challenge because you know there are at least 4 patients, so like 3 other patients in addition to their one, but also sometimes there are 6 other patients, right? And a lot of hospitals are short staffed, like meaning there's a lack of CNAs. There may not be a secretary or a monitor tech, and when there's no secretary or no monitor tech, the RNA has to wear, or the LVN or the RN or charge nurse or whatnot, they have to wear a lot of hats. And also you got to consider the communication with the doctors. Like if the doctors are busy, there's a lot of variables that go into how a shift is run and what could like be done. Um, so if everything is not like if everything is not going smooth, and when I say smooth, it could be because of multiple reasons. Like it could be a very busy CNA, because the CNA's got 12. They got a lot, probably like 17 patients that they got to take care of. So it could be a very busy one, or it could be one that's like possibly lazy. We don't know, or it could be coworkers of the actual licensed nurses that are not doing their job and making the CNA do it. So it could be lazy RNs or LVNs, or it could just be busy RNs and LVNs. It could be a lazy secretary, or it could be a busy secretary, or it could just be low staff. It could be a lazy charge nurse, or it could be a busy charge nurse, or it could not be a charge nurse at all because of low staff. Um, Basically saying that it could be a lot of variables that play into it, and everything is not going to always be sunshine, perfect clouds, and rainbow. So my last shift, man, and it's a lot of days that happen like this. Like me as a person, I like to be present for my patient. I sometimes give people the benefit of the doubt. Like I know we had a very busy CNA, right? So the CNAs do things like they change the patients, and they also not only do they change the patients, but they also like feed the patients, right? So I had a busy CNA. Like I honestly observed that he was really, really busy. We also rely on him to take vital signs, right? So because that CNA was busy, I had to do a lot of things for him in addition to my actual work, right? So you know, I had a patient where I got a report from. They said that patient was not consuming food, and when somebody hears that patient, the doctor has to take care of it. And when the doctor has to take care of it, that means that the doctor has to aggressively treat that, right? So I had this patient before, and I know that patient will eat if somebody stays there with him and feeds that patient, or prompts that patient, right? So I seen my CNA was busy, and I had to take care of things like that, right? and you also got to figure that while you do that, it's taking away time from like other patient time, right? So you got to prioritize serious things, like things that could lead to a patient, like passing away, and you got to prioritize those. Um, yeah, and kind of like work your magic on how you want that shift to, how that shift could go smoothly while your patients could be safe. During my last shift, I, see my CNA was busy for whatever the reason was. Um, so I had to do a lot of work, right? I never get to sit during my shifts, and I don't mind it because like I'm aware of what I signed up for, right? Um, the problem is, like I said, when you take your time to feed a patient, you gotta figure you're taking away from a lot of time from other things, but it has to be done, right? I don't want my patient to like starve, especially if they're like nonverbal. So, I just took the responsibility of like feeding the patient, um, and it is what it was. So, you know, there are more severe things that you gotta do as as a licensed nurse throughout the shift, like such as it's something called like straight catheter, like where like a patient may not have the ability to void, which is urinate. So what you have to do, you gotta find the bladder scan, see if it's above a certain amount, and per the doctor order, like put a little straight catheter up there, and do all this in like sterile technique, and get the urine out. So also, you got to figure it's going to be some patients that need to be changed. You don't want them in feces or urine all the time. So you got to like change that patient, right? Needless to say, I did all that during my shift, and that's what I do during my shift because at the end of the day, like you want your patients safe and you want everybody like comfortable. You want to like have dignity and integrity in what you do, right? Now, a lot of patients, family members, and a lot of like knock shift that come in, they're not going to know like how the day went. So because they don't know that how nursing work, it's not like a job where you get your stuff done and you could do 100% of like. Sorry, y'all, I'm walking out and I'm out of breath. Yeah, but anyway, it's not like a job where you could like do your 100% of everything and 100% everything is going to be done. You got to document because if you don't document, you could lose your license and all of that. So with everything that I said, add on top, you got to document. You got to make sure you gave all your medications and all of that. So family members and a lot of incoming or like the knock shift, right, graveyard shift, they don't understand that. So occasionally you will get a lot of like misunderstandings. I don't want to say attitude because I like to keep it professional, um, but you can't explain all of that. But yeah, that's typically how the day is. But I don't want anybody to be discouraged from like doing it. Like you walk away with a sense of pride and you know that you helped somebody, you treated somebody like you were their family member, and yeah, like it is like challenging, and family members not going to understand, your family not going to understand, but as long as you get it done, you will have like that internal pride, and I feel that it's worth it. Like, comment, and subscribe. I'm running out of time, and I may make part two. Peace out.